Hi, Grazel, how are you?
I'm doing good, Scott. How are you?
Yeah, pretty good, pretty good. Um, there's there's a difficulty um, that I don't think gets talked about a lot, particularly in relation to couples therapy, because couples therapy is so often about people getting back together and nurturing the relationship. But what happens when, say, you're in a situation where you and your partner have decided to separate, there are kids involved, so you know you need to relate to each other somehow. I mean, do you ever get people in that situation coming to therapy?
Yes, definitely. It's not uncommon for parents to come back together because they have a family to attend to and inquire about how can we create a co-parenting relationship that feels safe for the children.
Hmm.
I wouldn't say it's couples therapy,
Okay.
okay? It's co-parenting
Hmm.
type of work. That they need to learn. So they have to find someone who specializes in co-parenting,
Hmm.
right? And there are some parents that have separated, but then have difficulty coming together.
Yeah.
So they may need to talk to that co-parenting therapist individually first to create some safety on how they can come back together so
Hmm.
they can have an amicable dialogue about co-parenting.
Yeah. I mean, what would you say the goals of therapy in that situation are?
It's going to depend on what the what the parents want, right? So if they're afraid, let's say what I usually see is they come in and they're looking for support after a breakup,
Hmm.
right? And or after a divorce. And there's some uh parents are looking for, can we have co-parenting in an amicable way so that we can attend to our children in a safe, respectable manner,
Hmm.
right? That's a goal. And so some couples after the breakup, they don't want to be in the same space together because they haven't reached the separation that feels amicable for them. And that's a goal too. So looking at, okay, what do we create so that you don't have to fight in front of your children? What are you willing to commit to for the sake of your children so they're not affected by the divorce, right? And they're not affected by the emotional dysregulation that you both feel in moments of conflict.
Hmm.
Those are goals. So again, the priority is the safety of the children.
Yeah. I mean, that is pretty much the most important thing in that kind of situation, isn't it? Um, how do you approach it when maybe there hasn't been an amicable separation and one partner still wants to make the relationship work and the other person's already out of the door? How can you
Mm.
approach that?
Yes, those type of couples are couples that we call in discernment counseling mixed agenda couples, where one person is a leaning out partner and the other person is a leaning in partner. So if they've separated, but one partner is still leaning into the relationship and the other partner is out, then it's a mixed agenda couple. So they need to see a discernment counselor for that. Um, a discernment counselor will give them three paths. And the first path is looking at how to talk about the leaning in
Hmm.
and the leaning out partner and what that means for them, right? Whether that means they want to continue in the relationship or stay separated.
Yeah.
And then looking at those two paths. And then the third path is if they want to stay committed to each other, then they are sent back to couples therapy.
Mm.
Okay, so a discernment counselor is going to be an important person to reach out to.
And if you've got one person saying, I still want to be together, and the other person saying, no, I want to separate, does that make therapy completely impossible for that couple?
Yes, that's why they don't go to couples therapy. It's not because it's they have a mixed agenda, right? So they need, and that's why we have discernment counselors to be able to assist them with that type of presentation. And if you go to couples therapy, you're supposed to be still in the relationship.
Mhm. Okay.
Okay. Couples therapy are for couples that are still committed and making the relationship work.
Mhm.
Discernment counseling is when you're looking at discerning whether you want to stay or not in the relationship.
Yeah.
Yeah,
And if there is that mixed agenda, is that where each partner would need to be seeking individual therapy?
absolutely. It's always helpful. It's always helpful.
Okay, that makes sense. Um, so in terms of a situation where you've got a couple, they're both agreed they want to separate, but they need to be together, or need to be able to co-parent effectively. What sort of things do you typically find need to be in place to actually allow successful co-parenting? Like, are there particular boundaries that need to be put in place, or how does it work?
Right, right. I don't particularly work with parents that have been separated, and so there are therapists that specializes in that. But as a couples therapist, yes, there are important aspects to take account for, making sure that they both are willing to work on understanding the issues that put them in a place of separation so they don't bring it back in
Yeah.
to their co-parenting relationship.
Mhm.
That's very important, right? Because if they haven't really looked at those issues, it's going to bleed in to their co-parenting relationships.
Yeah.
So looking at that first, right? And assessing, okay, what do you understand about the issues that put you in a place of separation?
Mm.
If they both are aware of those issues, then it's really good to be able to say, okay, when those issues come up in your co-parenting, what skills do you have so that it doesn't infiltrate your co-parenting and it creates, you're able to create a safe ground for your children,
Hmm.
right?
Yeah.
That's my first priority.
Yeah, and that's kind of like couples therapy, but without the couple, in a sense.
Yeah.
Do you ever find that when the two people really dig into what caused them to separate, and maybe they have some kind of personal realizations, personal growth, they actually take another look at each other and think, actually, maybe we should give this another shot. Or once they've reached that point, are they pretty much always separated?
Yes, and that's what's beautiful about discernment counseling. And I'm trained as a discernment counselor. So I have that knowledge about kind of how to work with mixed agenda couples. I just don't see a lot of couples that are separating. So they usually come to me when they're still committed. But at the same time, I needed to be trained in discernment counseling just in case they end up breaking up.
Yeah.
But yes, there are moments where couples come back because they've looked at issues that brought them to separation and they were able to make it work, and then they go back to couples therapy. There are couples that are already separated and continue to stay separated because they can't seem to make it work. And that's okay too, so long as they're aware of that,
Yeah.
right? And there are couples that are continuing to be separated, they continue to be separated, but then they're looking at those issues so that it doesn't bleed into their work with their children.
Yeah. Yeah.
So yes, it can happen, right? There's always a path to creating an amicable relationship if both partners are committed to doing it, whether it's co-parenting or not.
Yeah. Okay. Just one more question. I'm not sure how if this is one you can really answer, but what sort of issues do you find most commonly in the situations that cause separation? So what kind of things crop up most commonly that maybe if someone's watching this, they can take a look at themselves and their relationship and work out, okay, this is an issue that's cropping up in my relationship. We need to take care of this to get on better.
Yeah, that's a great question. What I've found is that when couples don't seek help early on in their relationship and the negative cycle, meaning the dynamic that puts them in a place of feeling in contempt, it's kind of hard to get them back out of that contempt and create, of show vulnerability. They're so hurt and they're so pained by the issues in the relationship that they can't feel safe to come back into it. So I think one of the main reasons is not seeking help ahead of time.
Hmm.
Second is, if there are issues of power and control, like when there's abuse going on, that can be really hard too. Some of those couples don't seek therapy, um, and they just end up staying in the relationship,
Hmm.
or they end up leaving the relationship,
Yeah.
but then more abuse happens after that. So, other reasons would be either partner is no longer interested in making it work. They're done. They're just done. And I would be lucky if I find the reason why they're done. Sometimes they're just at that space where they can't even give you a reason anymore. They're completely checked out of the relationship. Sometimes affairs, continuous affairs that's happening, uh, active addiction can really create a rupture, a very deep rupture in relationships. And oh, I cannot, and one important thing is that, misunderstandings of culture and race and how other partner is misattributing certain behaviors as if it's a personalized attack. And this can happen in different neurotypes and different cultures, different races. So a lot of communication misunderstandings.
Yeah. Yeah. Yeah, which is where I know you guys, you're very culturally attuned. You're very, you make sure that all of the therapists under your supervision have that background of cultural awareness, racial awareness, making sure that you can relate to people on that level, which is really important as well. Um, yeah, thank you so much for your time again, and I'll speak to you again soon.
Thanks, Scott.